What is motor? This was my question. So he answered, he said something which moves. Okay. So can you tell me something more about motor?
Action
Can
system.
you tell me something more about motor?
It's the action system.
Action system, muscles, motor is related to muscle. So I'm sorry, you are not in mood.
No,
No,
totally.
it's not about you, there are many students. So although you know it all, you can tell me it is muscles, it is a part of the nervous system. This is what I want to know. Are we going to discuss kidney or blood? It is related with muscles and nerves. It is the thing which I can control by myself. You know, you can tell me many things, but you are not in a mood. So, Bismillah. Open your whatever you want to open, and I will go on my speed. Bismillah. No problem. I will be happy.
اخوان تفاعلوا.
No interaction. No problem. So you like this, that you don't want interaction. So it's okay. So identify and describe different types of movements. Describe function and organization of primary, pre and supplementary motor area. Identify brainstem and its motor functions. Identify spinal cord and explain spinal reflexes. Describe functions and liens of upper and lower motor neurons. And describe functions of basal ganglia and cerebellum. This is our 8 lecture syllabus. Whenever you like to interact, I will start interaction again. Otherwise, I would not read slides like I did just now. You have had renal with me, acid base with me, introduction with me. You know my habit. So if the students don't cooperate, I don't cooperate. There is no problem. All right. So this is the diagram which you were seeing. It is from the same slide. So this is nervous system. Nervous system is divided into central nervous system, which is in the center, brain and the spinal cord. It is not this that I will not teach. I will teach, but I will not be happy because you don't answer. Then from this, the twigs which appear, so this is in the center, marcus. So the things which go out, this is called periphery. So this is called peripheral nervous system. Then for the peripheral nervous system, we have got autonomic nervous system, which is not in our control, which we discussed in introduction, which includes sympathetic system, parasympathetic system. We discussed acetylcholine, we discussed noradrenaline, things like this. We gave examples of like, I am hungry and saliva is coming. It is not in my control. I have eaten food and the stomach is doing like this, churning it, mixing it. It is not in my control. I am breathing. It's not in my control. My heart is beating. It's not in my control. Autonomic nervous system. Beating of the heart is by a muscle. It is motor. But we don't put it in the classification of motor. Movement of the ureter to pass my urine into my bladder is motor, but we don't count it as motor because it's not in our control, because it is not periphery. You see, so there are many motor activities which we do not put it in the motor system. But we have got another classification, that is somatic nervous system. Soma means body. This is my body. Agreed that autonomic nervous system is also in the body, but this is special with our sense organs and voluntary muscles. This is the special thing. I can feel heat, I can feel cold, I can feel pain, I can feel vibration, I can feel the light, I can feel the sound waves, I can feel the taste, I can feel the smell. Senses, sensory system. So we take one part, sensory system. Then we are not talking about the intestine muscles, we are not talking about the bronchial muscle, we are not talking about the uterus, we are not talking about the bladder, we are not talking about our lungs, we are talking about voluntary muscles. So what are the voluntary muscles which I can control? which I can control. Last time in the autonomic nervous system, I told you, eating food, chewing it, voluntary. Taking it in, voluntary. But then it is involuntary. So up till here it is voluntary. So chewing food, voluntary motor. Taking food in, swallowing, this is voluntary motor. So the rule which we follow is this. I told you the general thing. Contraction of the heart, sympathetic, parasympathetic, autonomic nervous system, we don't say it is motor because it is not in our control. Peristalsis in the intestine, parasympathetic nervous system, it is in the autonomic nervous system. Although it is motor, it is involving the muscle, but we don't call it motor. So this is the start of our unit where we have 8 lectures inshallah. That is, we have got nervous system, in which we have got peripheral nervous system, in which we have got somatic nervous system, which has 2 parts. One is sensory, which will be discussed with you, and one is motor, which is coming before because it is your bread and butter and fulus. All your physiotherapy will depend on the link of the nervous system with the motor system. Your job is, yesterday, my father is 91 years of age, mashallah, even more. He will be 92 now, next few months. And last year, in fact, he got late COVID. He was fine first. He was going to masjid, doing everything. But then he became sick. Now he wants to get up from the bed, but his knees are locked. Yesterday also he started and he put his feet with the walker, but his knees are like this.
You can't straighten them.
He can't straighten them. Who will make it fine? Physiotherapy. Before that, when he had severe COVID, he was not having hunger. Who made it fine? You will be surprised. Not our medicine. It was physiotherapists who started giving him passive exercise, and because of the exercise, he used more ATP, and because of the ATP, he got hunger. So this is my point. This is our topic for the next 8 lectures, and we will be discussing it slowly. First, we recall this part. You know why we are going to recall this part? Because motor activity is not possible without a stimulus. Why I am telling you this? That this leg is not working because he has got an injury in the spinal cord, a cut over here. But his nerves are fine. Spinal cord is cut. Nerves are fine. If you don't give him exercise or stimulus, his muscles will die and they will be atrophied. So we have to learn in physiotherapy what type of stimulus, where to give, that I make his muscle move. One is passive exercise, the other is with the help of current. So we must know the sensory part to learn the motor part. So we go a little, just one slide for the sensory one. What is a stimulus? Stimulus is an internal or external change in our body. What is a stimulus? This temperature here, it is a stimulus. So this temperature here, it is a stimulus which is coming on me, and I want to wear something.
Yes.
You see? This seat has got a small pin in it, or something which is making a problem for me. I sit on it, and I stand and I remove this thing.
Stimulus.
So stimulus is any internal and external change. I was sitting here and teaching you, and suddenly I thought, where is my mobile?
Stimulus.
It is an internal stimulus. And I said, please, let me go and check where is my mobile. You see. So that is why we are discussing stimulus, which is part of the sensory system, going to the motor system. Okay, who receives the stimulus? Mustaqbil. What is the name for it?
Receptor.
Where does it go? It makes an action potential. What do you call this action potential? Impulse. This impulse goes in the sensory nerve. This sensory nerve goes into the spinal cord. What is spinal cord? It is central nervous system. Then it goes to Maktab Barid. You know Maktab Barid?
Male, yes.
Thalamus.
Thalamus.
In the brain there is Maktab Barid. Thalamus.
Like
What is the function of Maktab Barid?
doing the signal, giving the
You
action.
see, even forget about, because now you have got Maktab email. But still we have got Maktab Barid in Khumar and Daman and everywhere where you go. Okay, leave it. You know DHL, you know RMX, you know UPS and what? They have got a Maktab. What is their job?
To deliver the message.
We have got 20 packets. One is for him. The other one is for him. The other one is for him. So sending the message to proper place is the function of Maktab Barid. You see? So this is central nervous system, final part, that is the brain. So we discuss reverse of it now. Same diagram, but it is now reverse. Let me start once again. I touched this, and this had current. This had current. What was this?
Current.
What was this? Stimulus. Who felt it?
Hand.
Receptor.
Receptor.
Where did it go? My nerve. Where did it reach? My
Spinal.
CNS.
Oh.
Okay, spinal cord, CNS. What happened next?
Reaction.
Reaction. What is the name for reaction? Very
ATP.
good, very good.
ATP or
Reflex.
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 Okay.
What is the difference between this? See, what do you call this?
Fast reaction.
Reflex.
Reflex.
How is it different from, may I take your pen please? Give me your pen. This is not reflex. This is a goal-oriented movement. Football. Football. A ball came straight to your head. You see?
Yeah.
Now you are facing this side. But your sixth sense or your friend told, whatever. What will you do?
Bend down or anything.
But this is the goal and you are going to make the goal, and the pass came to your head.
You'll stay.
Now it is not reflex. Now you calculate and you get it. Are you understanding what I am saying? So there are two types of movements. One is reflexive movement and one is goal oriented. That is why I told you football. Goal. You know goal?
Yeah.
Goal.
Oh.
So one is reflexive movement and the other is goal oriented movement. I am not saying you are playing football. Please give me your pen. I have to write something. And this is my goal, to write something. You understand? So the same stimulus which reached my central nervous system, this sound is coming. Can you hear? Yes.
From yeah.
Yani I want to close it. If I close it, the projector will close. So what will I do?
Close.
I will not close it. Otherwise, how can I teach?
Oh yeah.
My point is this. Many stimuli which reach our central nervous system, we decide to ignore. This is the word. I was passing from here and he put his leg in front of me.
Yeah.
No problem. So one is this, that I will reflexly punch him. The other is this, ignore it. I don't want to compete with a young man who will beat me. You understand? So you know the word ignore.
Yes.
So the same stimulus, the central nervous system, it decides the reaction. Number one reaction, he put his leg in front of me. I look at him like with anger. Or I decide, smile and pass. or I decide.
Punch.
So you got the example?
Yes.
I am telling you about the reaction. Simply ignore. If there is some problem with your this trouser or your shirt, what will you do?
Fix it.
You will do like this. You know. But I am feeling this. Am I doing anything?
No.
I am wearing all these clothes. There is stimulus. When I was born, there was nothing on my body. They put these clothes on me. And now I put more and more and more. So my brain decides when to take reaction, when not to take reaction. This reaction becomes an impulse. Remember we discussed impulse in the sensory system just on the last slide?
Yeah.
Which goes in the
Motor nerve.
motor nerve. Now it is motor nerve. Now it is reverse. And what was here in the previous slide? Receptor. Here it is effector. What are the two effectors? Muscle and glands. As I told you in the autonomic nervous system. But here we are not discussing glands. We are not discussing smooth muscle. We are not discussing cardiac muscle. We are discussing only skeletal muscle, which is under the control of voluntary nerves. So, what is this?
Response.
Response to what?
Stimulus.
What about this stimulus that I was sitting here and suddenly I realized that I don't have my mobile?
Internal.
Internal stimulus. What is this stimulus that he put his leg in front of me and then I punched him?
External.
External stimulus. And we made the clear concept of you were facing this side and a ball was coming towards your head and your sixth sense told you and you did like this. Reflex. Or you were alert and this is goal and you put it like this. Goal oriented. Sahi? So this is reflex. Not in my control. It is very fast. Immediate involuntary response to a stimulus is called reflex. We have got 3 levels which control these things and teachers always start from this level. What is the lowest level of motor system? Forget about now sensory. What is the lowest level of the motor system?
Breathing.
What is the lowest level of the motor system? I am talking of CNS now, central nervous system. It is spinal cord.
Lowest level.
It is the lowest level of our motor system. That is spinal cord itself, it can control our lowest motor activity. What is the lowest motor activity?
Breathing.
Reflex. Forget about breathing now.
Yes.
I go back. Our topic is not this. 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 Our topic is
Out.
voluntary control.
Run.
So no breathing, no heart rate control, no GIT. It is just coming to this. So I told you what are the 2 types of motor activities? Reflexive and goal oriented. So this, do you have time to save your hand from burning? Do you have time to save your head from hitting the ball? No. Do you have time for the light is suddenly a flash of light has come and your bobo, it became small so that your retina does not get burned. Pupil. Do you have time?
No.
So it is very fast. What is the name of the thing which is immediate?
Reflex.
And it is involuntary, but we discuss it in the motor. It is reflex. Who controls the reflex?
Hypothalamus.
Come on. Spinal cord. Be bold. Even if you say wrong, I am happy. You said something. Spinal cord. So spinal cord controls my passing of urine. Remember last lecture?
Yeah, sacral. You said something.
You know, my bladder fills, there is contraction. Although it is parasympathetic, sympathetic, whatever it is. Just like that, you know, I am teaching and I am busy in teaching and I touch this and there is current. And I am very polite and I am doing very well and I am teaching you a very difficult subject, but I will still not hold it, current. You understand?
Yeah.
Who has done it? Did I do it voluntarily? No. It is the spinal cord. Next is the higher level, which is called middle level, which is the midbrain. It is the lower part of the brain. It determines strange thing. Listen. Now, some example. No problem. Okay. Now I understood. Keep on doing whatever. One, I'm just making concept of this. I am typing. Two, I am playing a piano.
Yeah.
You know piano?
Yeah.
So I have to make a rhythm. 3 beats here, and then I touch here. 3 beats here, then I touch here. 16 beats here, then I touch here. This is how you make music. And I remember what it is in front of me. You understand? Is this more complex activity, or when he put his leg in front of me, I was going? When he put his leg in front of me, I lost my balance and then I balanced myself. Which one is more complex?
More complex?
You see, yes.
The voluntary one.
The pianos, it is also motor activity. Using the keyboard it is motor activity. Throwing your basketball in the loop, it is motor activity. Putting the ball with your head into the goal, it is motor activity. You understand?
Okay.
For this you need the highest. You know the name, cerebral cortex, cerebrum. But for this, that when he put his leg in front of me, it is higher than the spinal cord because it has to be controlled from this area. What is under my hand? Come on, just go to the
cerebrum.
Just go to your knowledge of here, here.
Brain
So it is
stem.
medulla, it is pons, it is midbrain. It is not voluntary. But it is not as simple, fast reflex as was current here and just doing this. Because it is very complex. My body, I have got 90 kg of my weight. Imagine if it, central of gravity, yani jazabiya, or markaz for jazabiya. If we lose it, we are disbalanced. We fall. What is balance? We control it with the help of these muscles, which are here. Not these muscles with which we make piano or with which we throw the ball. You understand? So who controls, now you know what is posture?
Yes.
Keep on sitting like you are sitting. He is sitting with his leg on the other leg. He is sitting half turned this side. Look at him.
Which one?
This one. And he is lying down. This is posture. And he is also half tilted.
Yes.
This is the control from here. And he doesn't even know that I am sitting like this. Now when I have made him conscious, then he is thinking, oh, I am sitting like this. You understand? This is called posture. You see, maybe I am not noticing myself except there is a secret which Saleh knows by chance. I stand with my weight on this leg. I don't put my weight on this leg. So maybe you can see that I have a posture where generally I keep my leg like this. I am putting out a secret which by chance Saleh knows. This is posture. Who is controlling it? Spinal cord? No. Who is controlling it? Cerebrum?
Middle level.
It is the middle level. Brain stem. Posture and gross movements. What is gross movement? See, I have to play piano. But before playing the piano, please imagine, this is my piano, Yamaha. Do I start straight away from here?
No.
This is piano, huh?
No.
So this shoulder joint and this elbow joint and 5 muscles here, 2 muscles here, 6 12 muscles here. They take my hands here and then I start this. You understand? So this is called gross movement, big movement.
What difference between this movement and the movements of highest level?
Yes. So this movement is crude. You know, kham. Like you have got crude oil coming, you know. What is the difference between kham or crude and the benzene or the petrol that you get 95, for example,
Processed.
on the pump? Processing. So this is the fine movement which I have learned with high degree of precision with 12 years of exercise and learning. A chimpanzee cannot do it. It is very intelligent. And you remember I told you the Indonesian and Malaysian monkey, which is special, most intelligent.
Yes.
They cannot do it.
Okay, Doctor, but every case produce a different sound. Okay, which parts of brain decided which case I will take on them?
This is your experience.
It's
Do
very
you
complicated.
know a little bit about Tajweed? Tajweed al-Quran?
Yep.
Yes.
Have you learned from some teacher then when they teach which place in your mouth to hit?
Yep.
Oh.
It
It's
is
very complex.
So this is what it is.
Okay, which parts of the brain?
You answer me. You answer me.
No.
Don't ask me the question. Answer me. Answer me. Help him.
Is it one of these things?
Is it a reflex?
No.
No.
It's the highest
It's
level.
it's a
It is the
taste.
highest level.
Yes.
This is what I am teaching and this is the good question. My job finished.
Okay.
Because he says everyone does not know which key will make what sound. And good pianists, they know that this key is bad, it is not making that sound which is written there. So I have to press the same key on the other side. You see, highest level. So this is what I am saying. This is crude function that I take my hands to the piano. Middle level. But playing the keys with the help of my memory and the decision, what reaction to make. This is the highest level. So we have made our concept of the 3 levels of the motor system. So Allah subhanahu wa ta'ala has made the brain with different parts. And we know it now precisely. We have mapped it. The histology people in anatomy under the microscopes, they have seen that there are different type of neurons there. And physiologists, they have done many experiments which have told us many things. We will not go into too much detail. We will just pick up 5 or 6 important areas so that we know something about it. The first thing is to learn this word. Central sulcus. So the brain has got, this is anatomy, brain has got some high areas and some low areas. So it is just like these fingers. Can you see it?
Yeah.
So some are high areas and some are depressions. The depressions are called sulcus and the high areas are called gyrus, gyrus.
Giants.
Some people like to call it gyrus. One is gyrus, Jama is gyri. Okay, so the center depression, this is called central sulcus. In front of it is motor. So in front of it is motor and behind this is sensory. Okay, now you have got a ruler or president or king. Now listen to this point carefully. Is the king or the president or the leader or the ruler Isn't he the most powerful person?
He should be, yeah.
You know, make a road from there to there. Can he do it?
No,
Why?
I don't have money.
Make this make this building here. Remove this building from here. You understand?
Yeah.
Kill this person.
Okay, no.
You understand?
Yes.
And let this person go. I make him pardon of. You understand?
Yeah.
But is it really like this? That the king functions alone and no one is helping?
No.
So he has got shura, he has got minister, he has got bashir, many people who help him. I go back one level and then I'll come back. Sorry. Actually, this is the king, cerebral cortex. And two big ministers are cerebellum and basal ganglia. Just keep this in your mind, this will come later. Cerebellum is a minister who gives more power and he wants everyone to be killed. You know, this one person made a mistake. King says what to do, he says kill him. Basal ganglia is the polite minister. He says, don't kill him please, put him in the jail. I will go to his family, I will talk to them, they will talk to him. He is young boy, inshallah we will correct him. Are you understanding the difference? You see, I want to lift this table. I want to touch my nose. Big difference. But the cerebral cortex make mashwara with cerebellum and with basal ganglia. Basal ganglia says, don't put much force, otherwise you will break your muscles. Cerebellum says, put all your force because you have to pick it up. You understand? Cerebellum says, you have to remove a small thing from here. You can go out and make a round and come back. Go. Round and come back. So you just touch your nose because there is some small thing over your nose. Cerebellum says, do like this.
Oh.
Punch it, break it. Basal ganglia says, do it polite. It's the balance between cerebellum and basal ganglia that we want to discuss. This will be after 30 minutes, inshallah. But from here we are taking the point that even the cerebral cortex, it is divided into primary motor cortex, premotor cortex, and the supplementary area or the supplementary motor area. All of these, they support the function of the brain. We can see them here: primary motor cortex, supplementary motor cortex, and premotor cortex. So these are the shura. These are the shura. What do they do? Primary motor cortex, it is the main thing which is located in the precentral gyrus of the frontal lobe. It allows conscious control of the voluntary movement. I said this is the king.
Yes.
It controls the movement. It is composed of neurons, special neurons. I told you, the anatomy people, they have seen it under the microscope. They are like a haram, misr, you know, the makhrut, or whatever you like to call it. So they are pyramidal shape. I will use this name after 5 minutes, inshallah. And these fibers from here, they go to the spinal cord. And they make up the voluntary motor tract, which is called corticospinal tract. Nothing is difficult. You guys put a block in your mind when it comes to the nervous system. Cortex and spinal cord. A thing which is joining cortex with the spinal cord will be called corticospinal. A thing which is joining spinal cord with the cerebellum will be called spinocerebellar.
Just mix the names.
You know, from where it starts, we put first. So a sensory tract will be spinocortical. A motor tract will be corticospinal.
From where the signals come ولا from the
Yes,
actions?
from where it starts.
Okay.
So, somatotropic organization. Keep this in your mind. Soma means body. So, area of the body. Each area of the body is represented in our brain. I will show you that diagram after a few minutes. That is why I didn't give you the slides.
Yeah.
If I ask you a blank question, which area will have more representation in the cortex?
The
Just give me general idea. Yani, what do you think, what is the characteristic of a thing or area of the body which has got more representation in my motor cortex?
Finger.
Finger, why? Yes.
Hands.
Hands, why?
highest skill level.
So this is what I am saying. This is the answer which I want. He says highest skill level. We are talking of the highest center. You are right. He is saying fingers. For shoulder, I do not perform many functions with the shoulder. But with the finger, as he said, we can control different keys at different times. So, the more motor functions you perform with high skill level, you will have more representation. Now I take their answer. He said finger. And you said?
Hands.
Hands. And you like to say? Which place in the body has maximum function? Motor, not sensory. Remember, sensories are our lips.
Is the tongue
It is
highest?
tongue. But does the tongue function alone? This is exactly what I answered him when I told about the jewel. Tongue doesn't function alone. It functions with a lot of muscles, it hits the teeth, it has got palate on it. So we keep on thinking, just a couple of slides and we'll move further. Each muscle of the body is controlled by a specific area of the primary cortex. This is called somatotropic organization. This is MCQ. It controls the movement of the muscle on the
Opposite side.
opposite side. What is the medical word for opposite? Contralateral. Don't worry, it is written. What is the medical word or medical terminology for the same side? Ipsilateral. Ipsilateral, same side. Contralateral, opposite side. Right side of the brain controls the left side. Left side of the brain controls the right side. It is true everywhere except for cerebellum, not cerebrum. Cerebellum controls the same side. Okay, so we go further. Now, this is half sentence. It is corrected on the next slide. Representation of each body area is dependent upon, remember he said skills. So I will like to explain it on another slide. And finally, lesions of motor cortex result in paralysis or paresis. Paralysis is shunal. Paresis is weakness of the contralateral body area. What does contralateral mean?
Opposite.
So we read the concept. Let me repeat it. What is the function of primary motor cortex? Control the movement of the muscle on the opposite side. What is special about primary motor cortex? Each muscle is represented over here. What is problem if there is any problem with this primary motor cortex?
Paralysis.
Yes, there is either paralysis or paresis on the opposite side.
Okay, Doctor, somatotropic meaning voluntary conscious movements, okay?
Don't say this. Somatotropic means representation of soma. Soma means body.
Okay, what's the difference between conscious movement and voluntary movement?
I didn't understand your first word. What did you say first word?
Conscious.
Conscious movement.
Conscious movement.
And voluntary movement.
Did anyone tell you that there is a difference? Did anyone tell you that there is a difference? No, there is no difference.
Doctor, what's the specific?
Then let me finish with it. Conscious movement means voluntary movement. Subconscious movement means
Yeah.
reflex.
I know. Subconsciously.
So conscious is voluntary. Conscious is voluntary.
Okay, and voluntary, not voluntary movements.
I did not name anything sub.
That like when, okay, I take my phone, it's voluntary movement. Okay.
Yes.
But I can't, I did not know spell it. Conscious, okay. It's
No. Forget it. I understand now. You are saying conscious movement.
okay.
Yes. So what is conscious? Shauri. What is shaur?
Hmm.
Do you know what is shaur? When you do something, you see,
Awake.
this person kills someone and this person kills someone. They are taken to the judge.
Hakim.
You see,
Qadi.
he's told that this person, he is mentally invalid. But this person is mentally fully valid. There is no problem with his mental level. So he pardons this person, puts him in the hospital for treatment. You understand?
Yes.
So this is the difference. But conscious and voluntary, they are same. And we will keep on discussing it.
Doctor, the control movement on the opposite side, what does it mean?
It means that my right side of the brain, it is connected with my left side of muscles. And we will explain it in a diagram after a few minutes. What is the reason for that? What is hikmah or wisdom of Allah subhanahu wa ta'ala? That we don't know.
Yes.
But anatomy we know.
Okay.
This is somatotropic representation. This is called motor homunculus, representation of body in the primary motor cortex. Can you see which area is the biggest representation?
Face.
This is not for sensory. This is not for sensory. I am repeating it 3 times.
Motor.
This is just for motor. So the area where the muscles are used more. See, this is my chest. This is my shoulder. This is my abdomen somewhere here. It looks like big area. But do I play my football with this?
No.
Do I play piano with this? Do I write with this?
No.
You know? So these muscles, they are just for control of when he puts his leg in front of me. Posture. Balance. They need small area. Most of my tasks I do with my hands. And which place in the hand is the biggest area?
Thumb.
Thumb. Biggest area. But let's go to this, that even if I do not have hands, I keep on talking. I keep on giving expression with my face. I'm angry, I'm blank, I'm happy. You understand? So when we divide and we see, you see, eyes, forehead, where I can make these wrinkles, cheeks, big place for tongue, swallowing, so much big area. Is there any comparison of this with my abdomen and these areas? No. You see, my foot has bigger area as compared to my abdomen. I can do more things with my feet. So my dears, if we make this person, he will be like this. Are you understanding? This is motor. Yeah, this is all very weak. But this is huge because of this representation. And the biggest are the hands. Now, do you know the meaning of this word?
Yes. Body organization.
And do you know what Saleh said when I was asking, tell me something about how your body will be represented on the brain, in the motor cortex. So it is the level of the skills which can be learnt. So summary. Now we are preparing for the short answer question and MCQ. As I told you before, when I was teaching you introduction or renal system or all these, let's just trust me that I have said all these things, but we quickly look at that.
Yeah.
Lies anterior to the central sulcus, anatomy. Each muscle of the body is controlled by a special area of the primary motor cortex. Different muscle groups are not represented equally. It's not equal representation. What is the basis? The degree of representation is proportional to the, he said, skill. You remember? To the preciseness. Translate precise into Arabic. We want something to be perfect. Sahih. 100%. Mumtaz. You know, so we want something to be accurate. You know, if you throw a rocket from here and it has to go to moon, you miss it by, you know, a small fraction of millimeter here from the earth, it will never reach the moon. You understand? So precision means this skill. So the degree of representation is proportional to the preciseness of movement required for a particular part of the body. I can afford my shoulder to go like this or this, but I cannot afford my fingers to go wrong when I am writing and I am a khattab, or I am playing a piano, or I am a professional pianist. No problem with this, but this should be accurate. You understand? So that is why we have got this representation. More preciseness, more area. So more than 1/2 of the primary cortex, now listen this. More than 1/2 of the primary motor cortex is concerned with controlling only two things: hands and speech. And I said speech is not tongue. Speech is not tongue. It is lips and tongue and many other areas over here. So it's a big area. What is the function of the primary motor cortex? Execution of movements of muscle in the opposite side of the body. What is the problem of the disease? Lean means disease. Lean mean disease. Lean mean disease. Why we write lean? A gunshot wound can be lean. Tuberculosis or infection can be lean. Cancer can be lean. You understand? So all this lean. Lean means when you block something. When you make problem for something. So lean of motor cortex result in paralysis or paralysis of the
opposite side.
What is the proper word for opposite?
Contralateral.
So I have explained everything. This slide is, you can mark it Saleh here. This is the MCQ. All right. Then going back to this one, because now we have lost the track at what we were doing. I am discussing these three parts. These three parts make, the highest level. Then we will discuss cerebellum and basal ganglia. We are just stuck up in the cerebral cortex. In the I said we will discuss just 5 areas, not about 86 areas, which we discussed with the PhD students. So now we go to the rest of 2, the premotor and the supplementary motor. And few words about it. They are just shura, which give some advice. So premotor cortex, it is located anterior to the precentral gyrus. So this is gyrus. This was sulcus which goes down, gyrus which come up. So it is here. So anterior to precentral gyrus. What does it do? How is it different? Learned, repetitious or pattern motor activity, skill. Now is this the answer of his question. He said each key has different sound. So the person has learned it in many years. And this memory is stored. This is a special skill which this person has learned and I have not learned and he has not learned. You understand? So this area it controls and I repeat it again and again. So this is the repetition. And I learned it. And I do it. It is a pattern movement. That is why I said 3 times this, then this. 16 times this, then this. This is skill. You understand? So who is controlling it? I go back. Primary motor cortex. Who is doing it? This. Who is helping? Premotor cortex. So they help in the planning of the movement. And what will happen if there is a lesion or injury or infection? We get a disease which is called apraxia. Listen, don't be disturbed. Here we got shalal, paralysis. Here we get apraxia. What is it? Inability to perform voluntary movement in the absence of paralysis. Yani there is no shalal. But I forgot how to play piano. I forgot. I cannot write. I was writing very good just 3 days back. Now I have come to know that I cannot write properly. But I do not have weakness. I do not have weakness. I do not have shalal. This means a small area of my brain is damaged.
It's not amnesia, Doctor. It's not amnesia.
It's not?
Amnesia. Forget of memories.
Amnesia. No, it's not forget. That is something else. Because I'm not forgetting, I cannot do it. I want to write. Like I used to write beautiful Allah. Now I cannot write. I have not forgotten. I write in a wrong way. Because some blood vessel, it is damaged. Amnesia means when I forget about this. Apraxia means when I cannot do it.
Doctor, when they say muscle memory, does it mean that it's soft right there? Or?
Memory is not here. Memory is not here. It is, you see, I go to the word number 1. Learned, repetitious. I have learned it. I can do it while sleeping as well. I have experienced it so much. But now I cannot do it. Do I have shalal? Am I paralyzed?
No.
No. So this is not a problem with the primary cortex. Where is the problem? Is it the problem of amnesia, what he is saying? I forgot to write? No. I can tell, see, I want to write like this, like you are writing. But I don't know what has happened. I cannot write.
Coordination.
No, again, you are right, but that is cerebellum. If you use the word coordination,
Coordination of movement.
if you use that word, I will say it is cerebellum. So don't test your other aspects. But it is very good that he is trying to understand exactly what has happened. I say just concentrate on these 3 words.
Patterns, repetitious.
Yes, I agree there is a role of coordination. Yes, I agree there is a role of amnesia or forgetting. But the disease pattern will be different. Here the disease pattern is this, that I know how to write. But simply, I have stopped doing it as good as I was doing before. By the way, it can be due to basal ganglia also. But this is a difficult neurology thing anyway. What is the function of premotor cortex? It is just controlling learned repetitious pattern movement. MCQ, which disease do you get if there is problem with premotor cortex? Saleh, make it like this.
Okay.
Apraxia. Which disease do you get if you have got problem with this?
Paralysis.
Paralysis and paralysis.
Paresis is weakness. Paralysis is complete finish. Then we have got this supplementary motor area.
Yes.
Again, he is not the king. He is
middle level.
You know, king is this one.
Yeah.
So they are shura. Alright? This again has got a map of the body. It has got a different setting where the legs are in a posterior location and the face is in anterior location. The representation of different body parts have got overlap. Yani they are not like this one where there is no overlap. Yani one is not going on top of the other. But in that one, supplementary motor, it is possible that foot is coming on the hand area. You know, there are many movements which we do simultaneously. One is reflexive, but it is a good example. Reflexive is this: you cannot walk like this. This is not our routine walk. You understand? Reflexive walk is this, that I walk like this. One hand is going in front and the opposite leg. We don't notice it. We don't notice it. Yani, this is not normal walk. This is a child trying to amuse you.
Oh, yes.
This is not normal walk. Normal walk is this. So, who makes the rabt? The word he used, coordination. So, who makes some sort of connection between my leg and hand that they are moving together? You understand? So, this is where you need overlap. So, we have some overlap here in the representation. Stimulation of many areas, they lead to bilateral movement. This is the proof. SubhanAllah, when the people they are doing neurosurgery, when they open the brain, when you are removing something from the brain, cancer or something, you touch an area of the brain, the hand goes like this. The patient is under anesthesia. You touch another area and foot goes like this. You understand? So we have done many experiments on the animals. And the animal experiment tells that sometimes if we stimulate the supplementary motor area from here, this hand will go like this and this foot will go like this.
At the same time?
On the same time. Yani, I experimented again. Here. Now this is opposite side. So this is what made us learn the word overlap. And I will still consider his word coordination. Yani, many times in the body, different parts, they work together. So let's not get worried and we start normal 2 more areas. I said 5, yes.
I showed some bracelets, okay. They have an exercise. In the right hand, paint number 9 in English, okay, and the left hand, 6 number. It's supplementary tract.
Agreed.
It's controlled by.
I will not name the person, but there has been in persons in the history, and you also don't name if you know, who could work. And there are people. Yani here I am writing motor system definition, and with the other I am writing sensory system.
At the same time.
At the same time. There are people, and read about it in the net. This is not my topic. But there are people, we have a name for it.
Artistic?
No, this is not art. This is not art.
Ah.
This is special thing where 2 parts of your brains are fully independent and they are doing different functions. He is telling us about a high cognition brain exercise. So 2 small, just I said 5 areas we will do. So 2 small parts. Number 1, we have got this area. You remember premotor, supplementary motor, and primary motor cortex? In front we have got frontal eye field area, just for an example. So this area, if we stimulate it, it produces, a special type of eye movement on the opposite side. We call it conjugated movement. It is on the opposite eye. Yani, even the movement of the eyeballs, one eye is not moving, the other is moving, which we cannot do. Most of us cannot do it. If I say, keep one eye straight and move the other eye to the other side, So this is yani, by stimulating them we learn that there is some link because of which both eyes they see this side, both eyes see this side or up or down. It's not like this. You know the name of the animal? Small reptile. He can make one eye this side, this one other eye this side. It's like lizard, that change the color, chameleon or something like this.
حربة.
Both of these they make short answer question. Most famous part in the brain which you may always, you may already know it, Broca's area. What is the function of Broca's area? Where is the Broca's area? What does it do? Simply we say Broca's area is for language. This is MCQ. But SAQ, short answer question, what is the function of Broca's area? So it is, it is present only on one side, not both sides. Subhanallah. Mostly it is present on the left side. It is not present on both the sides. It is motor speech area. It has nothing to do with the memory to connect, that is Wernicke's area, which I am not teaching you. It makes me use my tongue and my lips and my vocal cords. Yani, my topic today is motor. So Broca's area control the motor speech area that directs the muscle involved in the speech. I don't want you to name them. But just see in the net in your free time how many muscles are there in the tongue. Just see in the net for some time how many nerves supply the tongue. It's not one nerve. You will be surprised. Then how many muscles control the base of the tongue where it is attached? So you will be surprised. So Allah subhanahu wa ta'ala has made a special area which when we damage due to an injury, due to blood vessel block, we stop speaking. Because motor speech it finishes. So if we put small electrodes in the brain, actually we put about 32 electrodes for electroencephalography.
Yeah.
And I have not started speaking, but I have decided that after this I will say a sentence. I am keeping quiet. He is talking and I have to ask a question. Now this is called, I am preparing to speak, but I am not speaking. So this light, it goes like this. Yani this area becomes active. So this is just an example for you to have. Saleh, what is the time?
Maybe 11 now.
It will be a little more.
11:13.
13. So we'll continue for 20 minutes and we'll finish, okay?
Inshallah.
We don't take a break. So my dears, we come to a very important slide based upon which we'll have one day full lecture, inshallah. But here it is very fast. Now we have to connect the brain with the muscle. What is this?
Muscle.
Come on. Everyone see,
fiber.
can you see it?
Muscle.
Muscle.
Yeah.
Or effector, what do you want to say? What is this?
Spinal cord.
Spinal.
cord.
What is this?
Brain.
Cortex.
Highest
Cortex.
level. Okay.
So Bismillah ar-Rahman ar-Rahim.
Bismillah.
A fiber or nerve starts, I will make it very easy. So just make the concept. Detail we will do after 2 lectures. This starts from where?
Cortex.
This starts from the motor cortex. It goes on which side?
Right.
Say ipsilateral side, same side. Now say ipsilateral.
Ipsilateral.
Same side, same side, same side, same side. How do I know same side? Because this is the midline. Agree?
Agree.
So this goes on the same side, same side, same side, same side, same side. Where have it reached? Where has it reached?
Spine.
Where has it reached?
Brainstem.
Brainstem. Name the last part of brainstem. Medulla.
Okay.
What does it do?
Transport. Go to the next area.
Very good. It goes to the, he says, it goes to the contralateral side. So make it easy. It crosses to the opposite side.
Crosses.
Make it easy. Crosses to the opposite side. Make it very difficult. It decussates. This is the proper medical word. It decussates.
English major.
And make it concept. It goes to the contralateral.
This
Doctor, does it always go to the other side of the medulla?
Khalas. I am talking about.
motor.
I am talking about
Motor.
only motor. And I am talking about only one fiber. Has it synapsed? What is a synapse? I told you just 2 lectures back.
Yes.
It is a junction between 2 neurons. Has it synapsed anywhere? Do you see any synapse?
No.
No. So it starts from the motor cortex, same side, medulla, crosses to the opposite side, medulla, crosses to the opposite side, contralateral side, goes down, wherever it has to reach, and
receptors. Reach the synapse threads.
And
What? Do the action? What
what was my question? There was no synapse before that. Now you can say it
Synapse.
is finishing and it is synapsing with another neuron,
Yeah.
which is starting from spinal cord.
What is the name of this tract?
Just wait for a minute. I will give you full detail of everything. Are you with me up till now? No.
Yes.
You lost me.
A little bit.
So a motor neuron, we have got the one which starts from the king, the primary motor cortex. It comes on the same side, at ipsilateral side, up to medulla. It crosses to the opposite side, contralateral side, goes down to the spinal cord to the level where it has to supply some muscle. And it ends on a special neuron in the spinal cord which is called alpha motor neuron. And it synapses with it. Now, another neuron starts from alpha motor neuron, which goes to muscle. If I ask you to name these 2 neurons, what will be the names?
The tract? The name? What? Upper motor neuron.
Simple. What are the
Lower
names?
motor neuron.
Upper motor.
Upper.
What is the name? Now listen. Who will be bold enough and define upper motor neuron? He will be the bold one. Yes. Define upper motor neuron from this diagram.
This line.
Let him do it. Upper motor neuron, it starts from the primary motor cortex.
To the middle.
It goes on the same side of same side of the body, reaches the medulla, crosses to the opposite side,
Lower.
and ends on the alpha motor neuron in the spinal cord at the level where it has to supply. For example, a neuron from my cortex is coming, and it is reaching my lumbar 5.
أيوة قالها.
It is not having synapse.
Yes.
And then it synapses with the lower motor neuron. LMN, lower motor neuron. UMN, upper motor neuron. Yes, who will, I will take your question afterward. Who will tell me the definition of lower motor neuron? Yes.
أنبر sacral.
No.
The spinal
Look
cord.
at here. Answer.
Okay.
What is lower motor neuron?
Under the line, this line.
Lower motor neurons, yes.
Start from alpha motor neuron, goes to the muscle.
To the muscle. If I cut from here,
واحد.
here is my nerve which supplies my hands. Is it upper motor neuron damaged or lower motor neuron damaged? Lower motor neuron damaged. If I cut from here, my brachial plexus,
No.
is it upper or lower?
No.
Lower. And God forbid if I cut from here, now there is confusion. Because some upper and some lower, it will be. But if I get damage here, which side I'll get shalal? Contralateral side.
Okay.
You understand? So this is the concept. I said, don't worry, I will have full lecture on this, which I will repeat, and I will do this again. So this was the basic concept of the motor control. Today my topic is different. I am not discussing the disease. I will discuss the disease of upper motor and lower motor later on. Today my topic is this, that we have got two types of descending tract. What does descending mean? Which goes from up to down. What does ascending mean?
Down to up?
Down to up. In terms of nervous system, what does ascending mean?
To the brain?
Sensory. And what does descending mean?
Signal?
Motor.
Motor.
So descending tracts are two types. One, Bismillah, who start from the cortex. I am not considering the crossing, okay? You just keep in your mind, medulla crossing. And straight go to the spinal cord. Let's say like this so that you are not confused. They start from the cerebral cortex and go on the same side, then cross to the opposite side, but do not synapse, and they reach the spinal cord alpha motor neuron, from where the lower motor neuron it starts. This is called pyramidal system. Don't worry. Next slide. And we have got another type of descending tracts or motor tracts. Can you see what is the difference? We have got an express train which goes from, those of you who know the train which goes from here to Riyadh. We have got an express train which does not stop on Hafuf or Bakik station. And we have got a train which stops at Hafuf. And it stops at Bakik. And then it goes to Riyadh. There is a different name for these trains. Are you understanding? So these tracks, they start from the cerebral cortex and they go to different nuclei. What is nucleus? Collection of the nerve cell body in the brain. From there, then the fibers, they go to the alpha motor neuron. Which one is fast? Which train is fast? Which stops at Hafuf or which goes straight to Riyadh?
Straight.
Which is more accurate?
Straight. لا أكيد.
Understand? The straight one, the direct one.
The straight is accurate. Okay.
So we have got two names, direct and indirect. Let's make them difficult. So this is corticospinal tract or the pyramidal tract. Yes, who will define corticospinal tract or pyramidal tract?
Directly from the
They are the nerve fibers, descending nerve fibers, which start from the primary motor cortex and go directly to the alpha motor neuron in the spinal cord. If you want to make it A plus, then tell the story that up to medulla they go on the ipsilateral side and then they cross to the opposite side and go contralateral side. But my point here is this, that they go direct. They start from the cells which are pyramid. So that is why they are called pyramidal tract. What is the name for the other one? Very simple. Extrapyramidal tracts. Can you define extrapyramidal tracts? They start not from the cerebral cortex, but they start from nuclei other than the cerebral cortex. But they have got a link with the cerebral cortex. You understand? Where is this train coming from? This train is coming from Dammam to Riyadh. Where is this train coming from? This train is coming from Hafuf. Didn't it come from Dammam? Yes. From Dammam it went to Hafuf and then it, but now it is coming from Hafuf. This is what I am saying. You understand? So these are the two types of fiber. There are many, but we don't want to discuss them individually. We call them pyramidal tracts. Let's do it for the final time. Pyramidal tracts, they start from the motor cortex, go on the same side, cross to the opposite side at the medulla level here, and then they end on the alpha motor neuron of the spinal cord. The extrapyramidal tracts, they start from different places in the brain stem. Some start from the midbrain, like the red nucleus. Don't worry, I'm not teaching you this. I'm not showing off that I know a lot. Just to give you the name. Red or Ahmad. Ahmad. In English it is, or sorry, medical terminology, it is called red or red nucleus or rubro. So red nucleus gives a tract to spinal cord. This will be called rubrospinal tract. Reticulum gives a tract to spinal cord. This is called reticulospinal tract. Vestibular nucleus, it gives a tract to spinal cord. This is called vestibulospinal tract. Olive nucleus, somewhere here, it gives a tract. It is called olivospinal tract. I am not showing off. Just giving you things which I am not teaching you. Our balance is controlled by cerebellum. Our balance is controlled by basal ganglia. Our balance is controlled by our postural muscles. But our balance is controlled by vestibulospinal tract. You understand? Not MCQ, not short answer question. But I'm just giving you an idea that everything is having a function. So let's go back to this diagram. How many types of descending tracts do we have?
Two.
Which one is direct?
Riyadh, straight spinal cord.
Now give me the answer. A plus question. Which tract is, no, it's not A plus, it is B plus. Which tract is controlling my playing the piano?
Left tract.
And which tract is controlling my movement or balancing myself?
Spinal.
See, the skills are fast. The skills are precise. The skills are perfect. So that is why corticospinal tract is controlling the distal muscles. And the crude function, control of my balance, taking my hand to the piano, it can be controlled by the indirect fibers. We don't need to waste much energy of the brain. Once my hand reaches there, now it is the job of the primary cortex. Direct tract. So we call them direct and indirect function. So the same thing which I said, now I put on the slides to prepare for the MCQs. So pyramidal tracts directly from cortex to spinal cord for discrete and detailed movements of the hand and fingers, distal muscle, control motor activity, right here piano, right here typing, right here throwing the ball in the basketball loop, right here kicking the football in a way that it spins and goes into the goal. Skillful movement, distal muscle, distal, proximal, distal, proximal. Distal, even this proximal. You understand? Now, indirect pathway or extrapyramidal pathway, indirect, direct. Through multiple accessory pathways from basal ganglia, cerebellum, various nuclei of the brainstem, cannot start motor activity, but they can help. I go back. Rubrospinal, tectospinal, vestibulospinal, reticular, vestibulospinal, reticulospinal. We are talking about these. They cannot start the motor activity. They can just help with this movement. Control of posture, things like this. So this is the transmission of signal from the motor cortex to the muscles. We have got pyramidal tract. Now see, I am just explaining those two. I am writing the same things which I said. Responsible for controlling. Come on, read it please.
Distal muscles.
Distal muscle on which side?
Opposite side.
On the contralateral side. Is it a direct pathway or indirect?
Direct.
We are discussing pyramidal. Direct pathway for discrete. What does discrete means?
Individual.
You know, very specific movements. I can, there are 5 boys out of you who can just turn one of this like this.
What do you mean?
You see, he answered discreet, Many of you can just do this finger like this.
Yes. Give it
Many of you can move your ears.
Yes, even this.
You see, many of you can touch your tongue with your nose.
I don't want to do this.
He stops them. Discrete and detailed movement of hand, finger, and speech. That is why I said tongue. I'm not pointing to him. He has got a very long tongue. What does it mean?
He can reach his,
He has got a very long tongue, means he talks too much.
Oh, okay, this not literally.
So he has got a perfect connection of the tongue with pyramidal system. What is the root of this tract? So same I discussed with you. Motor cortex forms medulla. What happens in medulla? It crosses to the opposite side. Motor neurons of the spinal cord on the opposite side. Inshallah, when I send these slides to you, there are some small videos which you can see, and there are links for that.
Where is bones in the diagram? Where is bones?
Where is?
The second pathway after.
It is not here. Second pathway is not here. This is just for the first pathway. You see, he's looking for the lower motor neuron from here.
Oh.
So I have not shown it. What will happen if the corticospinal tract, CST, corticospinal tract, this one, if this one gets damaged, what will happen? When will it happen? You have heard you see, remember this slide. I am not saying 90. I am saying 95% of your patients will be here.
Stroke.
And 4% will be here. You will be mostly treating the patients who have got stroke. You will say this is just shalal. Stroke, what is stroke? Bleeding. What is stroke? Blocking of the blood vessel. If it is blocked, the brain part dies because it does not get oxygen. If it bursts, the blood vessel bursts. Someone punched a person here. A ball, rugby player had got a hit here, injury.
Yes.
So bleeding inside, more blood, more blood, more blood, more blood, more blood.
Explosion.
Pressure on the brain. Again, blood vessels get blocked, ischemia, and if you remove the blood in time, the person will be 100% fine. We make a hole here, we call it burr hole, and we remove the blood. Those who have not done the attendance, I am finishing in 3 minutes. Please put the attendance, it is must, lazim. What topic we did not discuss in detail and I said we will discuss it? Upper motor neuron disease. Lesions to motor cortex will affect limb muscles contralateral to lesion. Why? SAQ question, short answer question. If there is problem with the primary motor cortex, why opposite side is affected? Very good. Why?
حكمة or anatomy?
Because the corticospinal tract crosses to the opposite side at the medulla level. This is the answer. You see, I asked the question once again. Sorry.
You want anatomy answer only?
Yes, short answer question.
Oh, not حكمة answer.
Why? Why? No, not hikmah.
Okay.
This Allah subhanahu wa ta'ala knows. I can just tell this that Allah wants maybe that when my brain gets some damage, at least one side is working. Not both go. Okay.
Maybe.
So this is, we don't know what is hikmah. So what is stroke? Stroke is called a cerebrovascular accident. It is the loss of brain function due to disturbance in the blood supply to the brain. Disturbance in blood supply to the brain. Disturbance in blood supply to the brain. You see, it can be hemorrhage. It can be blocking of the blood vessel. This is called embolus. Thrombosis, blood clotted. The most common forms are ischemia. What is ischemia? There is less blood flow. What is the name of the disease which lead to heart attack or myocardial infarction or angina? Ischemic heart disease. What happens? The blood vessel is constricted. or blocked, or there is thrombus. What is thrombus? Clotted blood. What do the doctor do? They remove the thrombus. What do the doctor do? They give an injection which dissolves the thrombus. What did the doctor do? They put a balloon and inflate the balloon.
Push.
So it makes it dilate. Or if it is not done, then they cut it and put a new blood vessel from here to here. Bypass. You understand? This road does not go in Riyadh. This bypass is Riyadh. So that I could come to the Dammam straight, not passing through the block. What are the risk factors? Don't eat much salt. You will get blood pressure. There is high chance of stroke. Don't smoke. After 20 years, your blood vessels will be going down. After 40 years, you will get stroke. No problem, doctor. I enjoy 40 years. Obesity, control your fat. Otherwise, your blood vessel will be like this. This is Naimi, inside blood vessel. Hypertension, smoking, obesity, and Ummul Amrat.
Diabetes.
This causes this.
This causes.
This causes this. You understand?
Yes.
So they are interrelated. What are the signs of stroke? Shalal. What it is. So read these small points from here. A person generally starts somewhere here, problem with the speech. Difficult trouble talking or understanding the speech. Confusion, dizziness, loss of balance, headache. I have got headache. Today I have got problem. And then after 5 hours, you come to know that Dr. Ahmed, may Allah help, he is in the hospital with Shalal. You understand? Eyes, trouble seeing in one or both eyes. Generally, it is one eye, blurred being. Early signs. Stomach, most people they vomit or have nausea. Nausea, nausea? Feeling like vomiting. Severe tiredness. Legs, there is paresthesia, difficulty in walking. This is telling signs that something is about to come. Something is about to come. When this happens, it is very fast. Face, arm or leg numbness or weakness mainly on one side of the body, that is the contralateral side. See you inshallah next week. Next week.